Hello, and welcome to East Africa NGO Podcast. I am your host, Patrick Hill. This program is sponsored by Team in Faith, supporting women, orphans, and vulnerable children in Uganda and elsewhere in East Africa since 2012. Well, no matter from where you are listening to this podcast, I suspect you have been impacted by the novel coronavirus. The world is in its 6th month dealing with this pandemic. Maybe your community, state, or country has been locked down to flatten the curve, to slow infections. Maybe you or someone you know has gotten sick and recovered from this deadly disease. I trust you're doing the needful, keeping your distance from others, wearing a mask, and washing your hands frequently. Here in America, some parts of the country are doing well with low infection rates, while others are struggling with the outbreaks. In Uganda and East Africa, site of Team in Faith projects, partners, friends, and family, the country has been in strict lockdown since March, which has helped keep a lid on the infections and spread. In this podcast, we'll learn more about how our African brothers and sisters are dealing with this global health crisis. Joining me today via Skype is Walter Mwesigye. He is a health reporter with NTV Uganda, one of the top news sources in the country. Hello, Walter. Thank you for joining me on East Africa NGO.
Yeah, thank you, Patrick, for having me.
So, we are in the midst of a global pandemic with this COVID-19. How are things in Uganda right now?
Well, we currently have 1,103 cases, confirmed cases, but that is a cumulative figure over the 4 months period that we have been with the infection around the country. Just to take you back a bit, most of our cases, actually the first cases, were imported cases from Ugandan nationals that were coming from abroad, especially in the UAE. That's where most of the numbers that confirmed positive for COVID-19 came from. And of course, we, had pockets here and there from the UK, from the Americas, elsewhere in India. And that was, Uganda confirmed its first case on the 21st of March. And before that, a week before, the president had, given his very first address to the nation on COVID-19 and what to, expect and what to do. And he had instituted, some measures, including, the start of the lockdown at that time. And limited movements, we had to be indoors by 7 p.m. and would not allow, there was a curfew, would not allow to move until 6:30 a.m. That curfew has just been lifted just recently in his last address, which was on Tuesday this week. And he has adjusted it to 9:30 p.m. And, you have to start moving at least by 5:30 a.m. But of course, this was after complaints, as he phased out the lockdown or as he eased the lockdown, people started increasing on the road. So there was a lot of traffic jam. Even when you would expect people to be home, people would come to work to town and they'd had to leave town by probably midday or 2 p.m. For somebody else to come to town at 10 a.m. It really wouldn't make sense for you to leave at midday or 2 because you still want to beat curfew. So, the first days people got stuck and they were arrested, but it couldn't work out. So police let everybody start moving, continuously going to their homes than keeping them at the police stations.
Yeah, it was March when things started shutting down across America as well. So you say that it was right around the 21st of March that the president instituted a strict lockdown. What has been the public reaction? I mean, have people, I assume, many people have complained about it like they have around the world. No one wants to be shut down. Yeah. But has it worked? Do you think it's helped keep the spread of infections under control?
Yeah, well, there's quite a bit of explanation, from the ground actually, and from the data that has been processed by scientists here. 21st March is when we registered our first case. And, since then, the lockdown was on. After that, everything was closed. The airport was closed. All the borders were closed. Up to now, actually, the borders are still closed, save for Ugandans who are returning home, only Ugandans who are returning home. But of course, this is also being done in phases. So when, those very strict measures were put in place, the explanation was that, and this from the Ministry of Health and the President and, the team of scientists on COVID-19, that we needed to, slow down the transmission and understand where or, the way it is manifesting into the country. And this gave, some positive results. Of course, when the president was, he's addressed in the 4 months period, he's addressed the nation 19 times.
Wow, and that's quite a few.
This means that he was almost in our faces each and every day. And, the first time or the first 3 months, people took this infection as seriously as, they talked about it. And, people were not moving. Of course, there were complaints about, livelihoods that had been affected. We have street kids, we have, people who work to earn their daily food each and every day. So the government put up some interventions to distribute food to 1.5 million people in Wakiso and Kampala district. Kampala, which is the capital city, but Wakiso is, like a very large district that also has some areas in Kampala inside it. For example, if you go to, NTV, which is in Kampala, it is not counted as that in Kampala district. It's in Wakiso district, but, the borders probably will have to be changed. It's another long process. We have to find our heritage from the UK. But that aside, the cases were coming in quite slowly. And the only cases that we had at the time, between March and May, the major cases that we had were from people who had returned from abroad. So between May, June, July, this is the current period now, many of the cases, actually most cases, were from Tanzania, Kenya, and South Sudan.
Your neighbors. Your neighbors.
Yeah. When the president instituted a lockdown, he only did not lock down goods that were coming into the country via the border. So those were like trucks, delivering goods to, because Uganda is a landlocked country, but also it is like it's a country that most of the countries around it use to access their goods. Rwanda, Democratic Republic of Congo, South Sudan, Burundi, so he couldn't lock out the trucks. And of course, the explanation from him was that we need to, continue getting some revenue as a country. Of course, after some time, this explanation did not make sense to people. After the cases kept on increasing from our neighbors, and that was around May, when the population, became really, really, try to think of a word, but they
annoyed.
Yeah, exactly. They became annoyed and, agitated that we are suffering in the lockdown, yet we don't have any new cases from around the country, and all the people that are coming in as confirmed cases are foreigners.
So it wasn't really spreading among the population so much because of the lockdown. Are you using masks? Are masks required, or are they widely used?
Yeah, so between our first case and the month of May, you would say our curve, which the explanation was that the lockdown was to flatten the curve. The curve was flat at the time. But when these cases from, truck drivers from outside the country started coming in, then the curve really stopped making sense. It kept on going up and up, and, people became agitated about it. At the time, we were not told to use masks because anyway, there were limited movements. It was only a few people they called essential services that, were working, including us journalists and some service providers. Yeah, but when the president eased the lockdown to allow the population get back to work, it is now mandatory that you have a mask on you if you're going out in a public space or a public place. And, our private cars can only carry 4 people, including the driver, and all of you must have masks. The public service vehicles carry half the number they are supposed to carry. For example, we have taxis here, which are 14-seaters.
The matatus, yes. And so those are, so they can only carry half their capacity. Wow.
Yeah.
Well, that's going to impact their incomes and their livelihoods there, I would think.
It will surely, because, and of course, the users will, are feeling the pinch because these guys have, almost tripled or, hiked the transport by 4 times from the normal prices. For example, I stay in Namugongo. The usual price we used to pay from where I stay in a taxi up to town is about 1,000 Uganda shillings. That's, that's less than $1. Yeah, but now, if I'm supposed to move from here to town, from Namugongo where I stay to town, I'll have to probably, part with about $2. And that's just for going. So a return journey would have to cost me $4, which is quite expensive.
Sure. Now, you've talked about life in the city there. What's it like upcountry or in the villages? Has the impact been as harsh? Do they feel it as much, or do they think the COVID is just some sort of something that's out there in the cities? Have the rural areas, the villagers, have they been impacted?
There are 2 things when we talk about the villages, because there are districts that are on the borders, and then there are districts that, are not in the borders, but of course they are definitely far away from the city. And the difference here is the districts on the borders are a bit, up and going. The fact that, they are close to the borders, there is a lot of business around there. So they are village districts, but they're not much of that village. There's some activity going on. And for those districts, actually, they're about 45 now. They are still under strict measures and a lockdown. There is no private or public transport services going on there because they think the cases or they will lead to community transmission if we let them open. But in the villages that are not close to the borders, for the last 3 days, I was in some districts, up country, and life is going on as usual. Actually, even bars that side were open, salons were open, unlike here in the city. So it's not been much of a very big thing for them.
Okay.
It's a village, yeah. But they know about the infection because the information was passed over all over the country.
Sure. Yeah, it's those border districts that I'm familiar with, at least in the west and the southwest, Kabale, Kanungu, Kasese, Rwenzori. And so, there are, direct routes into either Rwanda or Congo. And so, I can see a lot of transport. Now, your schools and most places have been closed, so that has to have an impact there. Schools have been closed here in America, and there's quite a bit of discussion about how and when to open them. The government may want to open them, but I don't know how confident people are in, sending their kids off to school at this time. There's, a lot of people just don't want to participate just yet because we're just not certain what the impact can be since the virus is still out of control. Our schools remain shut in Uganda, correct?
Yeah, schools, bars, recreational areas are still under lockdown. Gyms, spas, stuff like that.
Same
Closed.
here.
Yeah, it's only recently after his address on Tuesday, the president allowed salons to open, but also with very strict measures. Everybody working in the salon must have a face mask and a face shield. And of course, adding on two lines, washing hands, sanitizer, and all that. And these ones just opened recently. Also, we had arcades, or you'd say shopping malls, that had been closed, and they were also permitted to work after inspection to verify that they won't be, the cause of you'd say this time a viral transmission. And so those malls that were allowed to work only have, to use one entry and exit, unlike the previous days where you'd cut through a mall and go into another building. So there's no more crisscrossing through the buildings, and there's no standing in the corridors. We had people who sell from corridors in our buildings, in the shopping arcades. All those have been told not to be there. The schools remain closed, and he said, they will make a big announcement by September when we're supposed to begin our third term. Now, when the lockdown started in March, our school system here had only gone a few days into the first term. The students here study, that is from, elementary to primary to A level, that is S6. So all that group studies in terms. So they do term 1, term 2, term 3 in a year. So now this year, by the time the lockdown started and all that corona thing, students had only gone in just a few days into first term. The government says they will make an announcement before third term starts in September. But, it's been tricky because when they were listening around, they had South Africa opened schools and, over 200 or close to 200 pupils contracted COVID-19, and up to, I think, 50 teachers still contracted the infection. So things like that make it a very tough.
It sounds like just a lost year for the students, or at least more than two terms and maybe even a third. But one of the surprising things about Uganda's handling of the COVID is that while you've kept a pretty good lid on the number of infections, deaths have been
very minimal.
Been no deaths.
Until Friday, when it was announced that we had recorded our first COVID-19 death, and this was a female from eastern Uganda. And it is said that she has a partner who lives in Kenya, and they assume this partner probably could have been the one who spread the infection. And when she went to the hospital, they say she presented with signs and symptoms of COVID-19 and died, just hours later or a day later. The first time, the ministry, of course, wasn't very sure, so they had to do a post-mortem, and it was, confirmed that she was infected with COVID-19. And of course, anybody who dies with COVID-19, is registered as a COVID-19 death. So we have registered our first death. But we have been very stringent as a country, of course, from the address of the president, the president's speeches. And there's been a lot of awareness, actually, that has been done. And that's why I say that the president has been in our faces almost every day to talk to us about the infection. So people actually listened and learned a lot. You'd go to any shop anywhere across the country and you'd find you'll find they have, a jerrycan and some soap for you to wash hands before you can enter. They've sealed off all the entries, so you have to wait from a distance. So people have actually understood that the infection is there and it's real. The only challenge came when, we were not recording any death and people thought now it was a hoax. And of course, there's all conspiracy theories that, it's not true. And of course, some also emerged from your country there when people were accusing Bill Gates of, manufacturing this. So there are some people who go on to start interpreting such messages that come through social media, even without, a single bit of truth in them.
Yeah, that's a big problem. There's just so many channels and so many opportunities for people to, raise conspiracy theories, and so it really confuses a lot of people who aren't very meticulous about researching on their own or picking reliable sources for information. So it's a difficult time for sure, and it just requires people, being patient. But it's hard to do when people can't go to work, in East Africa or even in the USA, and people are certainly getting frustrated. Africa, or I should say Uganda, has mostly a fairly young and healthy population. I say that because having lived there a number of years, most of the population is like under 40 years old. I mean, the average or the average age and median age is quite young. So that may have something to do with the way, deaths have been kept low, because the people are much more healthy. In the U.S., we skew as an older population, or we have. I mean, it's the older people who've been leading the way in infections and deaths, but it has cut a whole cross section. I mean, every age group has been impacted, but not to the extent that the older people are, or who have pre-existing conditions which compounds their problems. So what's your best guess on how the lockdown, and how soon do you think the government is going to ease restrictions to allow life to get somewhat back to normal there?
Cases are still increasing, and now we have some pockets of community transmission from some of our districts in northern Uganda, in Amuru district, in Arua, even here in Kampala, we have some pockets of community transmission. Not so many, but every day when they release the results of the previous tests, we have about 5 cases that are from within the communities, and that's what the Ministry of Health is still trying to establish, where these cases from. But you'd asked about the general age or age structure of our country, which is a very young population. The median is probably 35. And I would like to tell you that the lady who lost her life was 38 years. So she wasn't that old. The scientists also told me personally, when I was interacting with them, that we have a patient who is about 28, a gentleman, and he's in a very bad condition. But of course, he has some underlying illnesses, and which the doctors think the underlying illnesses would probably be, the cause of his death if he doesn't survive. But we've had, over 970 recoveries. And the explanation was that most of these people are very young and strong, people. They have a very strong immunity. But of course, we've been also using some, treatment, including hydroxychloroquine, before it was the very first days when they had patients for COVID-19. It was part of the treatment regimen that was being given to the patients. But after some time, of course, there were questions raised on the side effects, and it was stopped. But we are now going into clinical trials by our scientists to see if it's effective. And they say when they do it in vitro, they've seen very positive results, but they are still trying to establish if, it does the same in the human body. And also, they are collecting blood from the people who have recovered to use their plasma to be able to treat, other COVID-19 patients. And, this thing together with South Africa, which is trying to make a vaccine here in Africa. It's the first country.
Well, it surely is an incredible time. And speaking on behalf of my wife, who's from Toro in Rwenzori, I don't know when we will be able to travel back there. I mean, 2021 is certainly out of the question, or 2020, I should say, is out of the question. Maybe 21. I know Emirates, and we would fly through Dubai, UAE, and of course that would raise flags in Entebbe. But until Entebbe even allows flights from UAE, we don't really have much of a chance to get back home. So hopefully, the next 12 months we'll make some progress. There'll be some antivirals and other treatments that can bring this under control here in the North America and also in Africa. So life can resume. But it seems to me, though, many routine parts of life just aren't going to be the same. Here in America, a lot of work that would normally be in offices and places are now done remotely. I mean, because we have, great internet capability here, much greater than Uganda has. So many people are working from home. They may never need or be required to go back to an office again, except for, scheduled meetings or something. It's really changing the landscape here. And of course, one of the biggest impacts has been with the airline industry, which has been virtually grounded around the world. And getting that off the ground again is going to take years, I think. Well, Walter, I really appreciate your time and expertise in explaining the situation from East Africa, East Africa and Uganda in particular, one of my favorite places. Let me just remind our listeners that you are a health reporter for NTV Uganda, and no matter, wherever you are listening to this podcast, you can stream NTV News on NTV's YouTube channel, NTV Uganda's YouTube channel, and you can get a live stream. They have two broadcasts, a Luganda, and the local language version at 7 p.m. East African time, which is 10 hours ahead of where I'm at on the west coast of the U.S. And then they have a 9 p.m. Well, there's two broadcasts, one English version and one the local language. So they can look for you, Walter Mwesigye, doing a health report during the week on live TV. Once again, Walter, thank you very much for your participation.
All right. Very grateful to help out. I'll be available for any other questions probably and clarifications if there is.
Sounds very good. We will talk again. Wabare nnyo, Sebo. Wabare nnyo.
Kale Sebo. Sula bulungi.
Once again, that was Walter Mwesigye, a health reporter with NTV Uganda in Kampala. And just to update some numbers that Walter gave us earlier in this podcast, as of August 8th, Uganda has experienced 1,267 cumulative cases of coronavirus, and there now have been 6 deaths. Thank you for listening today. If you are able and interested, make a donation to support our projects involving women, orphans, and vulnerable children. You can visit our website at teaminfaith.org. I'll be back again soon to introduce you to another organization that is helping our brothers and sisters in East Africa. For East Africa NGO, I'm Patrick Hill.